Welcome to our 5th international conference. I'm Joachim Sturmberg. I very welcome you to this, unfortunately, still virtual new normal event, which I hope you will enjoy, despite knowing that most of us are somewhat zoomed out at this point in time. Hopefully, the next meeting will be in person again, and we can look forward to the new normal being the old normal, being there in person, having lots of time to interact in person and have informal discussions about whatever is on our minds. For this session, we try to allocate as much time as possible for discussions rather than having long presentations. What we encourage you to do is use the chat function to interact amongst each other during the presentation and stay muted at all times so that we don't have any interference. And when it comes to the discussion, if you raise your hand, the moderators then will give you the floor, and don't forget to unmute at that point in time. As you've seen, the conference is recorded, and we will make the recordings available on the website in the next couple of weeks. So with that short preamble, let's get started and ask with the question of what is the role of systems and complexity sciences for health? In the first instance, what we really need is a change in the way we think about things. It is still the prevailing view within the community at large to think in parts like Isaac Newton so successfully did in physics, but we have failed to really embrace Humboldt's insight only 100 years after Newton, that the world is interconnected and that you only can understand phenomena if you also understand them, their context and how they interact. So currently, we still have this somewhat dichotomous view of seeing health either as a personal experience or as a biological abnormality, whereas health really is a complex phenomenon which arises from the interactions between the subjective and the objective. And as the picture shows, this is what has emerged out of research that some of us here on the call have worked on together, trying to figure out what are the interconnections that lead to health based on the external environment or the socioeconomic aspects impacting on health. How does that connect up with the biological changes we see? I'm not going to explain that any further. The paper is readily available for you to read the details. But principle boils down to the fact that our external environment gets into our bodies via the physiological stress response. And I think that really is a step forward of thinking about health in an interconnected and interdependent way. That said, the purpose of our society is just to explore this in all of the different dimensions. And we really, as a society, envision that systems thinking becomes the new normal, and that systems and complexity thinking professionals and policymakers and the community come together for the benefit of all of us at all levels. This is our track record on promoting these ideas. 7 years ago, we had our first conference in Washington. And as you can see, the themes of our conferences always have led us to look at the interdependencies that impact on health, and that will continue into the future. When did the future start? Some people say it was the 8th of December when the first case of coronavirus was identified and created a new normal. I would hope that it only created an intermittent break rather than an ongoing new normal. And I just finish off this introduction before we have the first discussion showing you some of the themes that I think are creating the new world order, the image of the virus, the daily data spectacle of absolute numbers only, the consequence being creating fear and perpetuating fear, the media circus every day in all parts of the world. But it has personal impacts, personal repercussions. The rate of domestic violence, the rate of depression and anxiety have risen. The impact on the elderly living in residential aged care facilities is just devastating. Schooling for kids, dealing with grief of those that have passed on from the disease. And it has great impact on the health workforce and the social care workforce at all the different levels. Everyone is exhausted and exasperated. The lockdown, a wonderful one-size-fits-all approach. Lots of debate about how useful that really is or has been. And then you have the issue of the deniers and the research publication hype. I let you read the joke for yourselves. And then is a question, what have we learned from the new normal, the virtual reality? We talk about everyone being zoomed out. Despite the wonderful things that we can do to stay connected, it's just not the same and people are hiding behind the chair. So essentially coming to the key question, what will the new normal look like? Crises are a great opportunity. With that, I hand over to Kevin to lead the discussion. And that's really the question I think we should look at. Has the time come for systems and complexity thinking to redesign healthcare and the healthcare system?
Okay, well, that was unexpected. So, Joachim, thank you very much for that overview. That it's what we're trying to do is to make sense out of something that is, at least in scope and extent, different than anything we've seen before in our memory. Certainly there have been pandemics and other disruptions in world history, but for most of us alive today, this has been quite different at a time when health and healthcare and the health system were already showing signs of needing rethinking and redesign. And so we've got, as you said, both the crisis and the opportunity. Are they going to be working together? Or are they going to be fighting each other? So as we go into the first round of presentations, what are some of the thoughts of our attendees that we have of where the healthcare system, of what the concept of personal health, where all these things are going to be needing the benefits of systems and complexity thinking, systems and complexity literacy?
Well, thank you for that great introduction, Joachim. I think that we're in great danger of just going back to the old normal. I think that our systems have got, even though they've had this, disruption, there's a risk that the status quo is very attractive to policymakers, funders. And for example, things like telehealth, which has been a wonderful opportunity. There people are sort of wanting to go back to not having telehealth, the risks of telehealth, for example. So I think we're in danger of going back to the old normal. I don't know if I'm being too pessimistic. I wonder what other people think.
I think you are pretty right, because we are talking about a system, and systems are inherently resilient to return back to their prior state after perturbation. The question is this perturbation big enough to let the system fall apart on itself, to give the opportunity to start afresh again? It's certainly important to be out in that space and push into the redesign direction.
We had a message from Nia about modeling. Would you like to unmute yourself and just toss something out for the group right now?
Sure. So I'm interested in the dynamical modeling aspect of this topic, and that's why I joined in today. So I'm curious about what people think the relevant parameters are, what the dynamics look like, what alterations of those parameters might curb existing trends, right? So this is not a unique position these days, but that's why I'm here.
Okay, great. I hope we can get some of that addressed, at least to the discussions. Obviously, models are extremely powerful, and obviously they are products of the decisions that went into them, the parameters that are chosen and the values that are obtained for those parameters. As we saw from the COVID models throughout the course of the early stages of 12 different models showed 20 different scenarios. And so I think the whole subject of modeling is extremely important, and it's a sword that we can live by or die by. So I hope you get some answers, and you can steer our discussions towards some of the things that will influence the choice of the parameters and their values.
Thank you.
Anybody else have some questions they're hoping will get some illumination over the course of the next few hours? Ingrid, go ahead and unmute yourself, please.
Hello there. Good to be with you all. And I see some of my dear friends and colleagues here from within, I guess, coaching and facilitation within the health system. And I connected with Joachim along the way of understanding and bringing more of this, I guess, complexity and systems perspective, which we certainly learned about in our coaching journey as well. So an example might be having a group of, I guess, board to bedside people in a room exploring how do we have better aged care in our prison system, and using design thinking, complexity to do that. So lovely to connect with this community and hear more of what people are exploring and thinking. My beautiful younger sister was an intensive care nurse, and she struggled with burnout, and she was yelled at in a stressed out system the day that she decided to take her own life. So there's a personal journey for me as well at the heart of how we have better health systems. So big, heavy start, but good to be with you. Thank you.
Okay. Well, thank you, Ingrid, for that. Richard, why don't you unmute and share a little bit of what you're looking for here?
Hope you can hear me. Hi.
Yes, we can. Thank you.
So I work in Northern Ireland, and I have come to this because I've followed Joachim's work and Carmel's work through various literature sources, and complexity is tricky. Complexity, particularly in the climate of everybody's in their little bubbles of echo chambers, or whatever word you wish to use, it's making it very difficult to get appropriate human capital and appropriate, what I would call, quote unquote, human communication. So I'm quite interested to just sit back and listen to what everybody else has to say about how we redesign systems with a human plus complexity approach. I think is essential. And I can also, as a disclaimer, say I've also had burnout in the health system, and ultimately the systems that are around people can influence, people who might be predisposed to this to put them into these situations.
Absolutely, absolutely. And the it's not just people exposed to the system, but people are part of the system. And so there's the influence that the larger system has on individuals, and hopefully we can constructively push back as individuals to reshape the systems of which we are a part, that we don't have to be passive victims of things unfolding against our will, but with some collaboration, some intentionality, and as Ingrid pointed out, as well as you, Richard, the design thinking, the human factors, the human element, as well as the implications of all the interactions. Bringing that all together is no mean feat, and we're not going to solve the problems today, but hopefully we'll start some of the dialogues.
I think it's important to always keep in mind that there is not a system. A system is a system of systems. So it's the multitude of super systems and subsystems that make up the whole. Which is important to keep in mind, but also probably one of the greatest frustrations when it comes to modeling. What do you put into the model? Do you just model a particular small problem without also addressing the context in which that particular system exists? It becomes, in the end, in my view at least, a highly political exercise, trying to maintain or improve a system within the constraints that have created the now overwhelming difficulties in the health sector is just not possible. So it's a David and Goliath type situation we are in. Are we David or are we Goliath in the end? That's the question.
Well, and I would agree that when I speak of the system, usually I'm thinking of the system which is time, space, matter, energy, reality as we understand it, which is a bit daunting for most modeling parameters. So yes, we're looking at systems that are systems of systems, which are the socio-political, the economic, the ecological, the agricultural, the legal, transportation, as well as healthcare. I don't know if I said education. We have all of these dozens of systems, each of which are intractable and arguably dysfunctional in their own right, and they all are interacting with one another, and the net result is what we see, what we experience as human beings on a daily basis. So yes, it's the good news is that we understand systems. The bad news is when we understand systems, it can get a little intimidating. And how do we balance that by taking the big picture perspective to make sure we don't leave stones unturned without becoming completely overwhelmed by the enormity of the task? So those are things that I hope that we'll be exploring the next few hours as well.
Yeah. And I think to add to it, and Michelle will go into it in much more detail in a little while, is that even within our human species, we are having significant differences that affect our health. If you are from a minority group, if you are non-white, you are much more affected by, in terms of health outcomes, by the way the system operates. I'm looking forward to hearing more detail, Michelle, in a little while.
Anybody else like to throw something in? We've got about 3 minutes before we start our first presentation. Anybody like to someone we haven't heard from of what they're hoping to get from this?
Yes, I can wade in a little bit on on the idea that the constant struggle in systems of developing structure or organizing for performance, and the need to adapt or self-organize for adaptation seems to be a challenge whether we're looking at healthcare systems, economic systems, political systems, this constant dichotomy of developing for or organizing for performance versus the natural self-organizing adaptation sometimes can create conflicts in how we manage or try to manage complexity.
We have one more person, last one, Venet. If you would speak with us, you get the last word. Congratulations.
Thank you. I feel honored. And it's the first time that I'm actually attending this conference. So I only found out about the conference when I was doing research on complexity in healthcare, because I am actually a researcher in machine learning. So I develop a lot of predictive models. I think it was mentioned already, intensive care. And my research right now is basically establishing predictive models to predict different outcomes of patients in intensive care. But what I'm realizing really is that, these are not enough anymore. I think, some of the diseases are so complex that simply a machine learning model cannot capture the complexity of the diseases. And I'm talking in terms of both genetic layers, in terms of clinical parameters, in terms of interventions, and so on. So I was particularly interested to hear if someone has an opinion on this topic, because I think this is going to be probably the next frontier of research in healthcare.
All right, well, I hope that we get some of that covered for you. I mean, again, we're talking about such immense space and such immense depth that 4 hours is just barely enough to read the table of contents, much less to have good takeaways. But I hope that we'll have some of these undercurrents coming through all the presentations about how we down select from all the things that we could choose to model, and how we bring that into things like AI and machine learning, and do it in a time frame that allows us to get some use out of it.